Well, the number one risk factor for breast cancer is age. As women age, the risk for breast cancer increases. And that we cannot do anything about, obviously. But also as women age, they are more likely to be exposed to other risk factors like hormone exposures, especially after menopause, although now with the findings from the Women's Health Initiative studies, it is less likely that women will be put on hormones at menopause. But hormonal exposures are risk factors for breast cancer. And then you would think maybe what are the other situations where women are exposed to hormones? And that is the hormones that we are exposed to internally, meaning between the age at menarche and the age at menopause, for example, women are on and off exposed to hormones higher or lower depending on whether they are pregnant, whether they are taking other hormones. So hormones are associated with risk for breast cancer. Cigarette smoking, even passive cigarette smoking, could be also a risk factor for breast cancer. Exposure to carcinogens of any sort are being studied, and we cannot necessarily pinpoint some of them that we're exposed to in the general environment, but there are associations like that. Other risk factors include high-fat diet, include obesity, and you know, diet and obesity are really, really important to watch for if we want to lower our risk for breast cancer.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.